We've been using dry needling now the last few months. It's a relatively newer part of care in our profession, and we continue to look to really be on the cutting edge of whatever we can do next. Interestingly enough, you'll hear that it's a tool that we use, but it really follows fundamental principles that we've always used. So this is conceptually, it's not anything new for how we've been looking at the body and treating the body, but it is a new tool that we'll hear about and understand. So in being able to talk about dry needling, we need to just have a common understanding of, well, what is myofascial pain? Because that's what we deal with when we're really using needles to help people. So we need to understand what are trigger points, because that's what the fundamental piece is about myofascial pain. We'll talk about trigger point dry needling as far as what is it, how does it work, and what's the goals of it. How we use trigger point dry needling in our clinic. We have a couple of case studies very briefly to just give you a sense of some of the results we've had and some time for questions at the end. So myofascial pain is a term that relates to pain that comes from myofascial trigger points. So the thing that's important for us when people come to see us is understanding what their pain, what is causing their pain. And it may not always be just a one thing. And myofascial pain is not the cause of every pain that we see here. So it's really important that we understand what we're looking at and dealing with. But myofascial pain is different than nerve pain, for example. If you know of anybody who's had a herniated disc in their back and they've had the disc pressing on their sciatic nerve and they have pain down their leg, that's from the nerve. That's a different kind of pain than myofascial pain. Or you heard Dr. Loud talk about ligamentous problems, throwers from the elbow with strained ligaments, or some of the stress fracture problems from overuse. So there's different things that cause pain, and it's not all myofascial pain. So it's very important for us to know what is it that the person has, including pain from visceral pain, meaning from the organs. You can have pain that you're feeling in your shoulder that's not from the muscles in your shoulder. So what is a trigger point? Dr. Janet Travell was a physician who worked with John F. Kennedy in trying to help him get over his pain problems with his back that he had, and went on to do a lot of research in myofascial pain problems. Myofascial really means primarily muscle pain, and the other connective tissue around muscle is called fascia, so that's where you get the name. So myofascial trigger point is a hyperirritability spot, usually within a taut band of skeletal muscle or in the muscle's fascia, that's painful on compression and can give rise to a characteristic referred pain, so a very particular pattern that shows up with. It's tender and it may have autonomic phenomena. So what does that mean? Tender to palpate. Very common. Most of us have had some kind of, oh man, is that sore up there? And when I press on it, it hurts, but kind of feels good. Well, there's a great example. If you've ever pressed on that, and it's like, oh yeah, and you know that headache it feels like I get that headache I got. Well, there's a great example of a myofascial pain problem that you can have headache pain that's caused by a trigger point in this area here. So characteristic reference of pain is another important part of what a trigger point is. So you've seen the picture here. You may know a lot of people that have pain in their leg, and here's in the butt, down the leg, down into the calf. Oh, I have sciatica. Well, just because you have pain in your leg doesn't mean you have sciatica. Sciatica really means pain from the sciatic nerve. So there's a great example where these are trigger points in these muscles deep in the hip that cause pain in the leg. So you can see it's not even necessarily where the muscle is itself. So that's an example of a referred pattern that might be there. So have you seen anybody with arch pain or heel pain, two areas that are really common that people have. Plantar fasciitis is a term that's used for pain in the heel or in the arch of the foot. And if you've ever heard people say, yeah, I've had that for, oh, it took a year to go away, or I've had injections, I've had this, I've had that, didn't really help. Well, sometimes the reason that some of the things don't help is because if the problem is really here, or if the problem is farther up here that's causing that, well then there's a reason why they may not be getting much response if they're not treating the right thing. So, that's an important characteristic of myofascial pain. May have an autonomic phenomenon, which is like goosebumps or sweating or vasoconstriction. You can get those kind of reactions related to trigger points. Trigger points in muscles, oftentimes it might be painful to stretch that muscle or painful to activate that muscle. Muscles can be weak when they have trigger points in them. So if you can imagine, oh, well, somebody told me that muscle is weak, I've got to strengthen it. Jeez, I'm doing my exercises like crazy. And you retest them, but they're not getting stronger. Well, sometimes the reason that you don't get stronger when you do all your good work is because there's a phenomenon with trigger points that keep the muscle from really getting strong. There's active trigger points and latent trigger points. So active trigger points simply mean, oh, it's causing pain now. So if someone is having that heel pain, that's an active, and they have a trigger point here that's causing it. That's an active trigger point. You can have, the trigger point can be existing in that particular muscle, but you don't have the heel pain at the time. That's called a latent trigger point, meaning it's one of those things that might be waiting to happen, waiting to present itself with pain. So we get the story of people that are like, gosh, I don't know, I've been doing a certain activity, I've been a runner for all my life, and I haven't changed my habits, and I haven't been running excessively, but now I'm getting this problem, and they're telling me I have to cut back, and it's like, well, why? So sometimes there are latent issues that relate to some of those problems. So causes of myofascial trigger points. Acute trauma or overload. So what Dr. Loud was talking about, some of the injuries that kids may have, or grown-ups may have, when you traumatize an area, that can cause a trigger point to develop in a muscle. Or acute overload. You go to lift the box that you thought had 5 pounds in it, and it's like, no, it had 25 pounds in it. It's like, whoa! So you're not ready for it, and you really overload your system for what you think. Chronic kinds of things, again, Dr. Loud mentioned about chronic overuse things, sustained postures. So us as grown-ups oftentimes working at computers, maybe with not the greatest postures, and this is trying to demonstrate an example. The blue line is where your head would be in normal alignment, but really he's in forward head position. He actually looks pretty good compared to a lot of folks that we see. But sustained postures where you're actually activating certain muscles over long periods of time. Repeated movements. So if you're doing something, whether it's computer movement or a job or a task, or you're raking, those kind of things that it's over and over and over, those are some of the overuse things that can cause trigger points to develop. Radiculopathy is a big term for when there is some compression in the spine. People, as we get older, might have arthritic changes in our bones in our back. And if the discs compress where the nerves run out of the spine, if those are getting irritated a little bit, that's what's called a radiculopathy. And if that irritates the nerve, because the nerve is what provides the energy to the muscles, and the muscles are like a spring, they contract or they relax, they're very dynamic, they're controlled by the energy of the nervous system. If you irritate the nervous system, then that can be also a cause of trigger points. So just as a model, you have an injury, causes a release of calcium. The sarcomeres are just a part of the muscle. They shorten. So you get an increased demand in the muscle because it's now activated more than it should be, so it requires more energy. It doesn't have enough time to recover, so it's not getting recovery time. So there's prolonged shortening of the fibers in the tissue. Ischemic byproducts means, the muscle, it's red, it needs a lot of oxygen, gets a lot of blood supply. If you reduce the oxygenation going to the muscle because it's getting constricted, then you start to have byproduct buildup or waste products buildup, and it cycles itself. So that's how things happen, and then they can sustain themselves. So if you have something that's kind of ongoing, we have people in our clinic that that have had pain for a long time. And sometimes when people have pain for a long time, they may get told, you've had it for a long time, you're going to probably have to live with some of this stuff. And some people do have to live with some things. If your hip joint is worn out and you're going to have no cartilage and you keep walking on it, then that's one condition. But there are conditions that relate to things like this, that it's a mechanical issue, and it may be there for a long, long time because it's a mechanical thing that's not been targeted and treated and addressed. And so Becca will tell you about one of the tools we use now and how that works to address that stuff.
So, this dry needling, what is it? How many people in here have had acupuncture before? Just as a, okay, so this is not acupuncture. It is like acupuncture though. It uses a fine filament needle or an acupuncture needle to deactivate these trigger points within a top muscle band, so that sort of tight spot up in your shoulder area. How is it like acupuncture? Well, we are not doing acupuncture. That is a treatment based on Eastern medicine. Requires an Eastern medical diagnosis that people have had training in Chinese medicine, so we don't have that. Dry needling is a technique to treat the neuromuscular systems based on pain patterns, muscular dysfunction, and other orthopedic signs and symptoms. So that's a little bit where they differ. With dry needling, there's professional continuing education that goes on with it. So Bill and I have both been educated in it. You have to demonstrate competence with the needling in order to pass the course. It's within our scope of PT practice, and with that, we have extensive knowledge in muscular and nervous systems, along with just our movement patterns in general. So there's a lot that goes into being able to do this. Mechanisms of dry needling, here's kind of a picture of sorts with it. Its primary goal is desensitizing super sensitive structures and restoring motion and function. It's kind of our big picture idea. It does this through obtaining a local twitch response. So when we do dry needling with somebody, when the needle goes into a trigger point, it can elicit this twitch or kind of muscle spasm grabbing. That's part of the muscle relaxing. It decreases spontaneous electrical activity. So what is spontaneous electrical activity? It's a discrete locus of activity near a motor end plate. A lot of words. So if you have a nerve, it's got an end plate to it, has this activity going on that goes on with the muscle. It's characteristic in a trigger point, and it can actually be measured through an EMG. It releases the muscle shortening and removes the source of irritation by needling shortened paraspinal muscles. So like Bill was talking about, sometimes there can be a radiculopathy, where maybe your pain down in your foot is coming from something up in your back. Our nerves talk to each other along the whole chain, so there's some involvement with either neck or back areas in possible other parts of your body. Promotes healing through a local inflammation, which is necessary. It increases that white blood cell count to the area to help speed things up. And it also produces a neuromuscular reset. So picture this muscle is getting activity, and the needle kind of goes in, sort of resets everything. You're starting from a 0 point. Treatment effects with dry needling. What do we want to see? There's a mechanical effect, so that local twitch response or the spasm contraction of the muscle that allows it to then release. There's a chemical and cellular effect that goes on, so a vascular, inflammatory, or immune response. You increase blood flow to that area, can increase white blood cells there. There's an electrophysiologic response, which is this spontaneous electrical activity that we talked about. And then neurophysiologic changes. So it affects the ascending and descending pathway changes. It's changing those nerve responses or firing patterns that are sending messages to your brain that are going back down to the muscles. They kind of work together to change that muscle. So how does this all fit into our clinic and what we do? Like Bill said, it's still consistent with our current work and body of knowledge. This isn't really anything new in how we are treating patients. It's a new technique. It's another tool for us to address soft tissue structures. With it, we're increasing precision to some areas. We can go a lot deeper than what our hands can in muscle. Some of these needles are very small. Some of these needles can be very long, depending on the areas of body we're going into and the person we're working on. It also works on the reactivity of the muscle to the needle itself. So we use this in conjunction with everything else that we do. We're using it with our other soft tissue techniques, with our joint mobilizations, with therapeutic exercise, neuromuscular re-education, functional activity training, and movement patterns. This isn't a come into the clinic and be needled and you're good, because if we don't change the things that are contributing to these trigger points, you're just going to fall right back into having that same trigger point. So it is important that we are working on strength, and your change in posture, your change in activity, stretching, all of that other stuff that you think of with physical therapy. So case studies. Bill and I each have patients that we can briefly talk about. My patient KF came into the clinic when we first started doing this dry needling thing, saying she had had this knot in her shoulder for a number of years. She wasn't really sure what she did. It might have been from lifting something, and it just has stuck around. It's kind of this pain that's there. She goes on her daily activities, really isn't stopping her from doing anything, but she just feels it. It's there. She's also a yoga teacher. She's very active, aware of the body, feels like she's doing all the right things, but it's just not going away. So we did some dry needling to her upper trap, or that muscle, that golf ball that you feel up by your neck, for about 4 sessions. And with that, working on some postural strengthening ideas, other habits that just needed a little bit of tweaking. And in about 4 sessions, that knot was gone, and she felt like she was able to be more pain-free and kind of get over that hump. She tried massage therapy, she tried physical therapy and some other things, and nothing really made it go away. This seemed to. So it was a really good and interesting, fast response, quicker than I thought it was going to get better.
Well, let's see. I just have a couple of folks that, people I'm treating right now, so it's not the long case. One woman who's in her 40s is a regular runner. She's had pain in her heel for 7 months. She's had 3 injections and has been very regimented about backing off and resting and then trying to get back to things. So she's had just ongoing pain. So I just saw her for her second treatment, and she came back in and said, well, I've had 3 days, I've had no pain for 3 days. Now, that doesn't mean that that's everything here is like the cure for everything forever and ever, but that's an example where we have good success with treating these kind of problems previously, but sometimes the response is more rapid.
Yes. Could you speak a little louder?
Oh, yes. Sure. Yeah. So my example was one woman who's had some pain in her heel as a runner. She's in her 40s for about 7 months and did not respond to 3 injections and some other care. And on her second treatment, she came back in and she said, I've had 3 days where I've had no pain. I've got up in the morning, I didn't have any pain, and I've had 3 days without pain. Another gentleman is also in his 40s who has Parkinson's, but also works out regularly. We've treated him for a few weeks, actually, over probably 8 weeks. He's been gradually getting better, and he's been reluctant to have someone put a needle in his elbow. But after the first treatment, then he had 3 days of not having any pain in his elbow that he's not had. So those are just two examples where it's been a tool of what we've already been doing with people with our hands, but in those couple of cases, it's helped to speed up a response. And obviously, those people in those cases need more treatment to get a good sustained response. But that would be an example of how it's been helpful for us. Things. So I just ended by saying, as I said in the beginning, every pain is not a myofascial pain. And it's really important that we diagnose what the problem is and really treat that accordingly. This has been a very good tool for us. Yes?
Is dry needling an option for people who've had mild vasovagal reactions to vaccines and things in the past?
I think yes.
Could you repeat the question, please?
She was wondering if dry needling is appropriate for somebody who has had mild vasovagal changes with injections in the past or vaccines in the past. I would say yes, with a look at the person's medical history just to see what else could be going on.
That actually makes me think about, so what are the contraindications? Becca, you want to?
We would not, sure, we would not be doing dry needling on somebody with a blood disorder, obviously. We want them to clot. We would not be doing somebody who's pregnant. Cancer is a contraindication after surgery. So if we were to do needling on somebody's foot, say, and they had shoulder surgery, we're thinking a 6-week lifetime on that. For a surgery site to do needling around the area, it's about 12 weeks. After, just to let things heal, we are introducing something foreign to that area. We don't want to increase risk of infection. What else?
Those are the main things that I can think of.
Yeah.
Does dry needle therapy have anything in common with percussive massage therapy?
I don't think I know enough.
Percussive, well, I'm not sure. I would probably say, I was going to jump out and say, well, I don't think so, but I'm not sure that I know about percussive. We use percussive stuff. We learned that in school for respiratory care on things, but Judy, I'm not sure if it's something else that you're thinking about. Yes?
Why is it called dry needling?
Because we're not injecting something. It's a dry needle.
But acupuncture is injecting either.
That's right. So that is-
Okay.
that's right. So the other needle, like when you give somebody medicine, that's delivering
Right.
something that's wet. That's the difference.
But we can't call it acupuncture because we are not acupuncture. So.
Thank you for that question.
Can you, other than what you said about acupuncture being a philosophy of treatment, can you specify if there's any difference? Like, do you go deeper or not as deep as acupuncture?
I think you would.
Question, please? Can't hear.
Sure. The question is there a known real differentiation between the acupuncture and trigger point dry needling that you can really state? And that's a good question, because I think some folks that have had acupuncture, for example, sometimes the needles, they may put them in a certain depth for different reasons, and you may not even feel the needle very much sometimes. And for us, it's a very mechanical effect that we're looking for muscles that are really an irritable spot, and you're going to tend to feel that. If we use the needle and you don't really feel much, we're not hitting a trigger point. So we will go as deep as the trigger point is, and so in a lot of cases we go down to maybe the level of the bone, where acupuncture may not be going anywhere near that for a variety of reasons that they may be using the point.
Acupuncture is also working on the principle of Chinese meridians. So you have energy flow within your body, and it's working on those. We are specifically going to a specific muscle and finding the trigger point within that muscle. So differs a little bit.
I'm certainly no expert on acupuncture, but I've received acupuncture. I have not received dry needling, but I've watched the dry needling. And I know when I had acupuncture, they would put the needles in and leave them
Correct.
for a period of time. And with the dry needling, I've watched them put the needle in and they're making very small knitting movements with the needle, kind of in and out, very tiny movements. But then they take the needle out and then they move to another place and do it. So it's a little bit more of an instantaneous type of thing rather than putting the needle in and leaving it there, from what I've observed anyway.
Thanks, Marcia. Yeah. Good. Well, I think we're happy to answer any of the questions in the back if you have them, but we'll finish up here and give Dr. Gregory a chance to get set up and give his talk.
Thank you.